All right, and we're gonna do this on 3, okay, Cole? All right, here we go. 1, 2, 3.
The perfect smile. Achieving it can be an awkward affair, requiring moldings, brackets, and tightened wires. But in recent years, a new technology has helped to accelerate orthodontic treatment. This device, a cone beam CT scanner, quickly produced these precise 3D images of the teeth and jaw.
All of this has a high degree of accuracy.
Dentists and orthodontists have flocked to the new technology, which shortens office visits.
I was just amazed because it only took a year and a month.
But although the cone beam CT scanner saves time and can identify hidden problems, some experts say it comes at a price: increased radiation exposure.
My concern is that the amount of radiation generated in these scans is substantially more than in a regular dental X-ray.
The device you see behind me is called the Pax-Survey 3D.
It's a lucrative industry, and a New York Times investigation reveals its popularity is driven in part by misinformation from dentists, paid or sponsored by cone beam manufacturers.
There are times, certainly, when cone beam CT scans make a lot of sense. When you're doing major oral surgery, when you're doing implant dentistry.
But Boston dentist and Harvard instructor Nicholas Delarusso questions the use of CT scanners for routine orthodontic screenings.
We've all become seduced by the beauty of the images, and we've forgotten about what it costs to get those images in terms of radiation exposure.
Okay.
Orthodontist Edward Lynn has been straightening teeth in Green Bay for the past decade.
You got a tough situation, but you've been doing great with everything, buddy.
In September of 2006, Dr. Lynn and his colleagues began offering a new computerized orthodontic procedure called SureSmile.
This wire here gets created off of the CT scan. We can actually change the bite. The chin is placed right here. Then there's a head strap.
Using this cone beam dental CT scanner, called the iCat, Dr. Lynn captures 3D images of his patient's teeth.
I think the most important value is it gives us much better diagnostic capabilities because we get to see roots. We can actively treat, provide therapeutic care to our patients utilizing a CT scan.
Some experts say the 3D CT scans produce up to 5 times as much radiation as a conventional 2D X-ray. And unlike with medical scans, there are few regulations for dental radiology.
So that beam of X-ray is going through the patient's brain, eyes, tongue, salivary glands, spinal cord, all vital organs that are very susceptible to the effects of ionizing radiation.
It looks scary. It's a machine where you put your head in, this thing just revolves around, but it's not that bad at all. You just gotta sit still, so.
Looks great. Kind of forgot how it can look.
Tomek Miaskowski, a patient of Dr. Lynn's, has just gotten his braces off. During his 13-month treatment, he received 2 CT scans.
Are you concerned at all about the radiation that comes out of those?
To be concerned, you have to be educated, and I'm not really educated in that, but I trust the doctors, so that's what you gotta do.
But for the thousands of orthodontists like Dr. Lynn who use the cone beam technology, there is little independent research regarding its safety.
Almost all of the information about radiation exposure comes from the people who manufacture the X-ray machines.
Some of the bigger manufacturers pay dentists and orthodontists to promote their products on the lecture circuit. One company even underwrote this issue of the Journal of the American Dental Association. Some even hold cone beam sweepstakes.
Do you think orthodontists know exactly how much radiation their equipment is administering?
I think they have a vague idea, but nobody knows exactly.
There's a lot of evidence out there that in fact the quality control is not as good as it should be.
Dr. David Brenner directs the Center for Radiological Research at Columbia University.
One of the risks that we are particularly concerned about for children is thyroid cancer, radiation-induced thyroid cancer.
Most experts agree that one cone beam CT scan is highly unlikely to cause cancer. But orthodontic patients, often young, frequently get more than one scan during treatment.
Children in general are more sensitive to radiation than adults. Perhaps 5 to 10 times more sensitive, but certainly as you have more scans, there is no doubt that the risk will go up.
Dr. James K. Ma has been described as a world expert on 3D technology by the orthodontic community. He has given numerous seminars promoting dental cone beam use. In an online lecture sponsored by Imaging Sciences, one of the largest cone beam manufacturers, he compared a CT scan to an airport body scan, a claim Dr. Brenner refutes.
The doses from an airport scan are way, way less than the doses from a cone beam dental CT.
In November of 2010, Dr. Ma offered a cone beam lecture at the Union League of Philadelphia. The New York Times was prevented from attending, and Dr. Ma refused to answer a reporter's questions regarding cone beam safety.
Give you a little air here.
For orthodontists like Dr. Lin, using the technology comes with a large price tag.
Dental CT scan, that costs us $225,000. So that's a big chunk of change.
I can't understand why the people who make these machines, expensive machines, why they can't have a digital readout on the machine that indicates how much radiation was generated by that scan.
Imaging Sciences, the manufacturer of the iCat, declined to be interviewed, but said in a statement that their scanners give dentists the ability to view patient anatomy more accurately.
Some sort of system where every CT scanner, for example, has to be regulated in terms of quality control would seem to us to be a potential solution.